is where we focus on topics that touch on health and well-being with an emphasis on fostering conversations that matter. And so today we turn our attention to a subject that's often shrouded in stigma and silence, and it's male infertility. While much of the focus on infertility has traditionally been on women, studies reveal that male factors, contribute to about 40 to 50% of all infertility cases globally. Male infertility affects not just the individual, but families, relationships, and societal perceptions. It's an honor to have, we're going to be discussing the male infertility topic, which is a topic that carries significant emotional, cultural, and medical weight. All right, many men and their partners, silently face challenges in conceiving, often without the knowledge, information, or support they need. And our work here is to basically discuss about how better to help them all confront this issue head on.
And so joining us today to demystify male infertility and shed light on men's reproductive health is our, I think I can call him in-house doctor now. Dr. Haroun is in the house again. Dr. Yusuf Haroun,
Thank
welcome.
you very much.
You've come to answer a question. She talked about an old Western about shooting blanks. Right. So let's get to it. Male infertility. First of all, I always like to start any health discussion with asking about the prevalence of an ailment.
Now,
40 to 50% of families.
Oh, you said that. Let the doctor tell us now.
yes, that's absolutely
Is she correct?
Yeah. Now, it's 40 to 50% of causes of infertility is the male factor. 40 to 50% also is a female factor. Then about 10% is idiopathic or unknown. Now, about the prevalence you talked about, it's about 7% of the world population are having this male infertility is boiled down to the male. So in Nigeria now, the shooting blanks we talked about, it's a very, very ironic question because we can't actually point out to a physical cause of how you determine that, okay, this man is shooting blanks. But there is one particular way you can know. Number one, if a man is having constant sexual intercourse with a woman for 1 year and the woman is fertile or she has given birth, then definitely you can suspect that this man has a problem. Another way you can know from the signs is if you see that this man is having or unable to maintain good erection. Erectile dysfunction could be also a sign to know that this man is shooting blanks. For example, he can't last long in bed. That doesn't mean that someone who can't last long can't get a woman pregnant, but there could be an underlying cause, a cause to why he is not able to last long. Another sign you can know is if the man is having loss of hair features. A man normally should be hairy. So if this man is having low hair growing out on his face, on his body.
Maybe like patches in their beards, for example?
Not absolutely. This man may not even have much hair. Then also another way you could know is if the man is having swelling in his testicles, in his balls.
Yeah, we would never know that.
The man will know. The man.
Yeah, I get you.
If a man feels that there's a swelling in his testicles. Now, then in terms of the sperm also, appearance of the sperm, if the man ejaculates or comes, and he says that the sperm is not the normal sperm looks whitish gray. Some people might say it's like a catarrh or mucus or pap. Normal sperm smells like bleach, ammonia. It is alkaline. Also, a normal sperm, it has about 1.5 to 5 mils when he ejaculates, when he releases. So if you look at the syringe which a nurse used to give injection, 5 mils, a normal sperm should fill it. So if the man releases and the sperm is less than even 1.5 mils, the man should be suspicious that maybe he's having a problem with his sperm. And the major cause of male infertility is sperm problem.
Oh, yes.
Sperm problem, not erectile problems.
Not erectile. A man can have erectile dysfunction.
Yet be able. Like
Unable to, yes. Another thing many people don't know is that even the pre-cum can get a woman pregnant.
No.
Yes.
That is
sperm
not,
cells.
we've had this debate from
It can.
secondary school to university to beer parlor discussions.
It can. There's a patient that came to me.
now.
The woman came heavy.
No.
Boy.
This woman came heavy.
That is a moment that should go on
It
Instagram.
is. This woman was heavy, and she came, doctor, my man never came inside me. We've been having this for several years. how come I got pregnant? And I said, do you use a protection at all? Do you use anything? She says, no. And I told her, do you know even this pre-cum during the act also contains sperm? Many people don't know there's a difference between the sperm and the cum or semen.
Semen.
What we see with our naked eye is the semen.
Which is the carrier.
Right. That is, you got the right word. Now, the sperm itself is microscopic. Inside a normal sperm, there should be about 15 million. Inside a normal sperm, there should be about 15. Inside a normal semen or cum, there should be about 15 million sperm cells. That's another way to know. So if you do a semen analysis, if it's less than 15 million, you can be suspicious that this person might have a problem. There's even the home kits now. A man can buy the home kit and test his sperm even at home. It can't be as accurate as going to the laboratory, but it could also be suggestive if this man is having a low sperm count.
Does habit have any role to play?
Absolutely. Lifestyle has a big
Here we
role
go
to
again.
play.
You're about to say smoking,
Even the
lack of
vaping we talked
sedentary
about.
lifestyle, riding a bike.
All these are risk factors, but that doesn't mean that, oh, there's a man who smokes, he drinks, he sits down, and he got 10, 20 women pregnant. That doesn't mean he cannot get a woman pregnant. But these are risk factors medicine lets us understand.
Okay.
So I'm glad we're talking about risk factors, right? Because that means that any man a man could be as healthy as a horse, you know what I mean? Very agile and still be shooting blanks.
Absolutely. That is true.
So what then will be the health, what then will be solutions? Let's talk solutions. Or better yet, before we even talk solutions, if someone is watching and, hearing this and be like, okay, this sounds a lot like what my own blanks look like, what will be the first step, to seeking help?
A man can look physically healthy, he can have the six-pack, he can even have a big manhood and yet shoot blanks. Now, the solution also he might even release, his semen might even look normal, grayish-white in appearance, normal volume, yet he's shooting blanks. So the solution to it, number one, he has to really do a test to know if truly his sperm is viable. There are different kinds. It could have low sperm count, which could be called oligospermia. It could have no sperm count at all, which is azoospermia. And there could also be a defect in the shape of the sperm. A sperm normally looks like a tadpole. It has the head, it has the body where the mitochondria is, the energy, the powerhouse, and it has the tail which swims to fertilize the egg. So the solution to it is, number one, the man has to change his lifestyle. Is he smoking too much? Is he drinking too much? Is he having a sedentary lifestyle? Is he taking excessive fat? Hypertension, diabetes are also risk factors to it. Another thing he has to do is he has to also see a medical doctor, a urologist or a fertility doctor in particular, that is going to test him to know if he is shooting blanks. That is through what we call SFA, seminal fluid analysis. If there is a solution to him according to the medical doctor, he may be placed on medication. There's what we call testosterone injection due to the cause, if it's hormonal balance or problems like that.
I've got one more factor I want to ask about.
The final one is IVF. That's it then. So these are three main ways: lifestyle modification, medication, finally IVF.
Which is a
in
last
vitro
resort.
fertilization. That's the last result.
So my other very curious question is whether age has anything to do.
Absolutely correct. You got the right word. After a man gets to the age of 35, his chances of having sperm problem or male infertility develops. Or
Say that again for those in the back.
35 years.
Because all those red pill
35.
men will sit down and be like, I have enough time. Baby, you don't. Okay? You
Red pill
don't.
men?
Yeah, red pill men. The ones that are always, they're followers of Andrew Tate. They call them red pill men. I know. See how old you are, because you don't know who they
I know who Andrew Tate is.
But you don't know that,
the
his
concept
followers
of a
are red pill, red pill men.
Oh,
so
I get
blue
you.
pill, red
Okay,
pill.
I
So
get
red pill synonymous to, synonymous to conservative.
Oh, okay.
Yeah, conservative.
Interesting.
Yeah, some men want to get to the age of 40 before they start to have a family, have children. They claim life begins at 40, but no, life is going down for men at 40. Everything is going down. Most diseases in men start from 40. One of the major problem men face at the age of 40 is prostate problem. Benign prostatic hyperplasia, BPH, prostate cancer. So when a man gets to the age of 40, he should start testing is blood.
I'm very embarrassed to ask my next question with Judith sitting here, but I'm going to ask
Go
it.
ahead,
because
baby.
apart
I've
from
seen
her being a
everything.
lady, there are tons of our
I've seen
viewers are
everything.
also... No, that's not what I was referring to. You're close. So my question is, this was an argument, and I dare say the scene was, it was a bear parlor conversation, but it was very relevant conversation. And the question was whether male manipulation of an organ actually helps protect or preserve a man's ability to continue having children.
What kind of manipulation?
Masturbation?
What kind of...
Yes,
that's what you were going to say?
Yes.
That took you so long?
Sorry, but
Just dancing around.
certain words are hard for me.
Now, statistics show that about 80 to 90% of the world population has engaged in masturbation in one form or the other. So it's not only men, women also. Surprisingly, even most toys purchased are sex toys from to satisfy the women. So I think even women, permit me, even do the more masturbation than even the men.
So does this help fertility for men in any way?
Now, a man who masturbates a lot, there's a higher tendency of his semen to
Lose quality.
look more watery.
So as the time goes
It
going.
looks more
so
watery.
that means,
but that doesn't mean it can
so that
pregnant a
means
woman.
sexual indiscipline and promiscuity would also...
Absolutely.
Say that again for those out of that.
Sexual
Because when you're about
promiscuity.
moving around with other women, you're losing the...
It can lead to what? Sexually transmitted infection. And there are 4 main causes. There are many others, but the 4 main causes of male infertility. Number 1 is sperm problem. Number 2, sexually transmitted infection from sexual promiscuity. Number 3 is environmental factors, paints, pesticides, things like that. That doesn't mean that if you stay where they are painting, you will have male infertility, but it's risk factors. And number 4 also, we have hormonal conditions. One thing the medical practitioner will not forgive me if I don't mention today is varicocele. Varicocele, just like we have on the legs, you see someone with a varicose vein, we have it in the balls too, or in the scrotum or in the testicles. The veins around the testicles, they also become, just like the ones we see on the leg, they become tortuous, they become big and enlarged, just like you see on some people's legs. And that problem could affect their sperm production or their sperm count.
But
Varicocele, some men have
doesn't
it.
house the sperm. It houses the semen, but not the sperm. The sperm comes from another organ.
Testicles. The testicles are the balls, what we call the balls.
Yeah.
So there are veins, blood supply, supplying
Okay, that leads
blood.
to...
Now, when these veins are compromised from varicose, especially the left testicles are the ones most affected. They do not supply. That is a question which people have been asking. Why is the left side more affected? Left kidney, left testicles, things like that. The heart is on the left side. But the left is more affected in this varicocele case. And men with this situation might develop male infertility from sperm low production, oligospermia.
I also have to talk about weight as well. Do you think that weight loss can help in improving male fertility, and can weight gain and overweight cause male infertility? Because I remember I was watching a documentary where they were looking at the signs of, the effects, the good effects of, the word I'm looking for, the pen for overweight, the ones that the people take now, that all the celebrities take, Ozempic, that it improves. Yes, so there's a pen that they take it every week, and you lose weight very quickly. As is happening in Hollywood.
Wow.
All the good stuff. So they said that with they tested a bunch of men, and as they took it, not only did their sex drive improve, but also their fertility increase. Is this true?
Now, there are many things people are using. In addition to that, there's also this steroid some people are using. Some of these things might even have a negative effect. One thing about Ozempic is that it's also anti-diabetic. It reduces blood sugar.
Yes.
Diabetes is a risk factor to male infertility.
I see why. Makes sense. Yeah, they said that. I forgot.
So hypertension, diabetes, some people, I remember our fathers or mothers, don't take too much sugar. It can affect your reproductive health. They may not know or understand the medical, scientific basis, but they just understand that, don't take excessive fatty things, don't take sweet things. But all these are intercorrelated, and they can affect a man's health. Steroids.
So what must one do to boost their if in the case of low sperm count?
Stop promiscuity. Let me start there.
After that, what could they do?
Number
Are
one,
the
improve your
medical-
lifestyle.
Improve your
Lifestyle
lifestyle.
improvement. Research has shown that people who improve their lifestyle get better, also even performance.
I didn't finish the question. I was leading somewhere. The point is, now in our culture, if you go to a Lagos bus stop, somebody will tell you something called monkey tail and how good it is for your virility and all of that. Being a botanist and somebody who studied plants, I have also been exposed to traditions where they say this plant is good for you, chew it in the morning, and it, you know, this is if you went to Abuja, for instance, that you'd be visited by these malam with tiny little seeds and tell you how good it is for your manhood, and they swear by it. So do these things work?
They work.
Sorry, let me call my friend in Abuja so that he can.
Now, but the problem about it is that there's no dosage, and there's no clinical trial also.
Right.
Now, the origin of Viagra, which people use, is a medical by Pfizer. Sildenafil is the botanical name, is the generic name, is the now pharmacological name. This drug also was derived from plants, and the woman who gave it to a patient was for the heart.
Yes.
But she noticed that the man developed strong erection.
Lucky him.
And that was how they started using the sildenafil or Viagra also for sexual enhancement. So all this type of local herbs, they do work, but there's no dosage. And when I was in nephrology unit, I noticed that some people come down with renal damage because they will take a high dose of these herbs, no measurement, no dosage.
Because of no clinical trials.
No clinical trials. We don't know which one she used. We don't know the amount to use. So they just take a whole bunch of the herbs
and overdo it.
Overdose with gin, with different things, and it damages the kidneys, damages the livers. They could go into renal nephropathy, and things like that. So I strongly recommend that all this should also be researched on, and there should be dosage on how we can. There's nothing wrong if Nigeria produces also all these sexual enhancements that pass through all clinical trials and they are internationally accepted.
Doctor, we must say thank you. You have done justice to this topic, and it's all thanks to me. I must say thank you, Dr. Yusuf Haroun. He is a doctor here from Love for Health. Hopefully I got it correctly.
Yes, maybe we'll talk of female infertility.
And he came in here just to give us a bit more insight as per male infertility, medical solutions, and also having an openness and understanding of male fertility. If you've been listening and you seem to have a sign, they have pointed to some small things that you seem to know is there. Please go and check. Thank you.